Namaste everyone. Welcome to the another class. So today onwards we are going to start one more course, that is Pharmacotherapeutics 1, which is meant for PharmD second year student. Simultaneously Pharmacotherapeutics 2 will come for PharmD third year students. Then Pharmacotherapeutics 3 will come for PharmD fourth year students. In this particular subjects we are going to discuss about various disease conditions. In that disease condition also we will be having two prime area of our focus. That first is the etiopathogenesis. Etiopathogenesis means how the disease will incept in our body and how it will progress until it will be clinically characterized. All those things we are going to discuss in etiopathogenesis, and how we are going to manage that. That comes under the pharmacotherapy. There are various means to manage it, sometime by using the pharmacological substances, and sometime without using the pharmacological substances, by mean of dietary changes, by mean of lifestyle changes, or sometime by mean of surgery, and sometime by education also. So all these modalities we are going to discuss in the pharmacotherapy portion. So these two prime area will be our focus point. Now in second year PharmD students syllabus, we are having basically 5 different units in the Pharmacotherapeutics 1 syllabus. Out of that, the first one is the cardiovascular system, where we will be discussing about the cardiac system and the vascular system, and the disorders or the disease conditions which are affecting the cardiovascular system. Those we are going to discuss here. Again, this unit is very important for exam point of view also. Heavyweight questions like long questions and long essays we can expect from this particular unit. In addition to that, we will be getting the medium and short answers also. Anyway, in short, this is very important system to understand. Then followed by, we are going to discuss about the respiratory system. In respiratory system, we are going to discuss about a few respiratory ailments like asthma, COPD, then some drug-induced pulmonary disorders, including the pulmonary function test. Similarly, our third unit in the focus will be the endocrine system, where we will be discussing about the disorders of the endocrine gland. So, though, like diabetes, again it's a metabolic disorder. Thyroid, it's another type of metabolic and endocrine disorder. Then similarly, we will be seeing about some other hormonal therapies which are extensively used nowadays in the clinical setup. Similarly, our another unit will be focusing on the general prescribing guideline. General prescribing guideline means what should be the point of consideration, what should be taken into the consideration while we are framing any pharmacological approach or any other approach, or non-pharmacological approach also among the specialized population. So there are various type of specialized population. However, our syllabus is basically focused in the pediatric population, means among the children's. Pediatric, some textbooks say age group of 12, some say up to 14 also. However, if there are children, so what are the things we need to keep it in our mind? That thing we are going to discuss here. Then here another is the geriatric patients. Again, in the geriatric also age criteria, it differs from country to country, organization to organization. So in general, above 60 or above 65. So what are the points that needs to be discussed, or what needs to be considered, that we are going to discuss here. And then another very vulnerable and important population, very susceptible population, that is pregnancy and breastfeeding. As we all know that pregnancy and breastfeeding are the physiological state. If a lady has to go through the pregnancy, then what are the points that needs to be taken care while designing the pharmacological therapy or any drug therapy? Those things we are going to discuss here. After that, our another unit will be discussing or focusing on the ophthalmological conditions like glaucoma and conjunctivitis. Then finally, we will be seeing the concept of essential drug list and rational drug use and formulations. So what are these concepts, why these are important, why our national policies, and why the global agencies like WHO, CDSCO, they are focusing in these guidelines and parameters, especially in the country like India, where there are the large population which are dependent on the pharmacological substances. So what is the role of these things and how we are ensuring these things we are going to discuss in this another unit. So with this our PT1, that is Pharmacotherapeutics 1 syllabus will be over. Now in the subsequent classes, we will be discussing about 1-1 conditions, 1-1 pharmacological condition, and 1-1 clinical condition. So here in this particular series, first we will be discussing about the cardiovascular system. In the cardiovascular system, serially we are going to cover all these topics, and we are discussing it from the understanding point of view and for exam point of view also. And so today I just want to give you some brief overview of what is cardiovascular system. Then from the another subsequent classes we are going to enter into the disease condition. Now without wasting much time, I am going to discuss about the background information of the cardiovascular system. What is cardiovascular system? So all those things we are going to discuss here. Now, in the cardiovascular system, as we have studied the cardiovascular system in the human anatomy and physiology of PharmD first year, that was the fundamental subject, which was a base subject for pathophysiology, and the combination of human anatomy and pathophysiology will give us a brief idea how pharmacotherapy works. In addition to the pharmacology, so this is like a wholesome, a comprehensive subject which will give us brief idea on the anatomy of the organs, then physiology of that particular organ or system, how it is working, then the pathophysiology situations, how the abnormalities in the physiological process or distortions from the physiological process are occurring, what is their mechanism, all those things we are going to discuss. And in that, if we are adding the concept of pharmacology along with the non-pharmacological measures, so that comprise, and it gives a wonderful product called pharmacotherapeutics that we are going to discuss in the coming series. Now let's recap some basic information of cardiovascular disease cardiovascular system before going to the cardiovascular diseases. So first let's understand what are the fundamentals on heart, what is heart, and how it looks, where it is situated, and how it works. So if we are knowing these fundamentals, then it will be easy for us to understand the cardiovascular conditions. So in pursuit of that, now let's see. So the heart is the organ which is having the size which is almost the size of our fist. If we will make a closed fist like this, so what is the size of this fist? It resembles the size of heart. So if a person body structure is small and his fist is small, then his heart will also be small. So that is a gross idea. It's not always technically true, but yes, it gives us gross idea. So it is in the superior to diaphragm. When we are going to see its relation with the neighboring organs or neighboring parts, then it is superior to diaphragm. So diaphragm is a layer which separates the thoracic cavity and abdominal cavity. So there is one separating layer. So this layer is known as diaphragm. It's a muscular layer. It is the muscle which helps in the respiration also. So above this heart lies. Then it is there in the left midline. Now let's say if this is a person, okay, let's assume this is a person. Now if this is a clavicle bone, we will hypothetically cut it into the equal half, then this is called midline. Now if this is the right side and this is the left side, in the left midline. So it is in the left midline. Our heart will somewhere come here around in the 4th to 5th intercostal space. So in this particular area, if there are ribs 1, 2, 3, 4, 5, 6 like this, so somewhere around 4 to 5 ribs here in the mid clavicular line, slightly outside of mid clavicular line, there will be the situation of heart in general, right? Then we are having the atrium and ventricle. This heart is the hollow organ which is having the chambers. So these chambers, the upside small chambers, we are telling them as auricles, and the larger one, the stronger with the thick wall, we are telling them as ventricles. Though, so in the alignment with the discussion, what we have to understand means, this heart, it is located in the thoracic cavity. Back side we are having vertebrae and front side we are having the ribs. It is heavily guarded by ribs in the front side and some portion of ribs and vertebrae from the backside so that it is not exposed to the foreign environment. Then here in between there is one bone. From this bone, this rib cage will come and attach to give the strength to our thoracic cavity. This bone is known as sternum bone. So in the front side, it is covered by ribs and the sternum bone. So this heart is having the protective layer. This layer is known as the pericardium layer. This is the external layer which covers the heart. Like lungs are covered by pleural layer, brain is covered by laryngeal layer. Similarly, our heart is covered by the pericardial layer. Then, so this mid layer of this heart is known as myocardium. Myocardium is basically the wall of heart. If this is a heart, this wall, this is known as myocardium layer, and the internal layer is called endocardium. This internal layer of this hollow structure, this heart, is known as endocardium. Hope you understand the basic anatomy of this. Then basically what is the work of this heart? This heart will pump the blood so that this pumped blood will go to our brain and body system. Now when this ventricles pump, it will send blood. This right ventricular will be sending the blood to the pulmonary artery, from where it will go to the lungs for filtration. From lungs, the filter blood will come back to the heart by left atrium. From left atrium, blood will come to the left ventricle. Now when this left ventricle will contract, the blood will go to the different parts of body, including brain and other body. But what we have to understand means, this heart, it's again an organ, right? For its survivability and for its functioning, it also require energy. That energy will be utilized in form of ATP. Yeah. To form this ATP, there should be a process called oxidative phosphorylation. Where in biochemistry last year we might have studied about glycolysis and Krebs cycle. It is happening in the mitochondria. That's why mitochondria is known as powerhouse of cell, because it is synthesizing the ATPs, that is energy, for our organs or cells to work. Now this glycolysis and Krebs cycle, we require some raw material to produce ATP. Those raw materials are glucose plus oxygen, along with some other nutrients or ions will be required. Now if this heart has to work, then it also require ATP, it also require energy. So oxidative phosphorylation should be there in the cardiac cells also. So for oxidative phosphorylation in the cardiac cells require glucose also and oxygen also. So there are some blood vessels which will supply blood to this heart itself. Those vessels are known as coronary arteries. So again, these will come in various heart disorders. We have to understand what are these coronary arteries, so that it will be easy for us to understand the disease of coronary artery in the coming classes. Hope we understood. So there are basically two major coronary artery, one in the right side, another in the left side, and they are having several major and minor branches which will take blood to the entire heart, and they will supply glucose and oxygen to the heart muscles and heart tissue, right? So this is entirely about the anatomy of heart. Now we will not go much into the detail of anatomy. I think this much of concept is sufficient to discuss about the various disorder of heart in our syllabus. Then physiology. These cells in the heart, they are having certain property which are very unique compared to the other cells or other organ system in our body. So first is the self-excitable cells are there. So this unique property of our heart or of our cell is known as automaticity. Means automatically our heart can excite. That tendency is there. It contracts, right? These cells in the heart, they contract as a unit, so that the entire organ will contract at once. Then it has long absolute refractory period, that is 250 microsecond. So what this will do, this is millisecond actually, ms. So what this will do means, this refractory period will help us in getting the rest to our heart. Similarly, we are having a property known as autorhythmicity. Autorhythmicity matlab ki there is one pattern of our heart which enables it to contract and dilate. Means the beat, what we will say as a heartbeat, there is particular rhythm how our heart should contract and relax. So that is known as rhythmicity. So our heart is having the special capacity that it can control its rhythm. So this is called initiation of action potential also. This autorhythmicity will enable our heart to induce the action potential. Now, there is one place called pacemaker. Which is actually initiating the action potential. In our heart, there is a unstable resting potential. Unstable resting potential matlab ki there is one electrical abnormalities is happening in our heart. It will go up to the minus 60 or minus 70 millivolt. So from where it will go to the resting potential. When it will reach here, the influx and efflux of ion will be taking place. When the sodium ion will come inside and calcium ion will come inside. Now this charge will recharge in the positive manner, right? So this depletion is known as the depolarization. Okay, now I will not go into the detail. Anyway, this physiology we are going to discuss during the cardiac arrhythmia, but just for our basic understanding, right? So this electrical shifting is happening throughout our heart, throughout our life. Right, so that is called unstable resting potential, which will continuously lead to the beating of heart, which enables heart to pump the blood. So there is a calcium influx for the rising action potential, as I have discussed here. And here, while discussing about the other important parameters, what we have to understand means this sinoauricular node, it generates the impulse. How much impulse it will generate? Around 70 to 80 impulses per minute. So sometime we will give a broad range like 60 to 100 also. Then this AB, that is atrioventricular, is there. It will receive the impulses which are generated by sinoauricular node. So it will receive it in little delayed fashion by 0.1 second. Then these will go to the bundle of His. So in the bundle of His, we are having two different types of fibers. That is, one is bundle branch, which will take this heartbeat to the apex of heart. This is known as apex of heart. Then similarly, this Purkinje fiber is there. It will take to the apex also, and then it will spread it to the ventricle also, so that this electrical information will go to the ventricle region. And in the ventricle region, when it will get electrical impulse, it will contract and it will pump the blood. So this is a basic illustration of our heartbeat. So here, what we have to understand means when there is a deflection in the ECG, if we will observe some ECG, this initiation of P wave, it indicates the atrial excitation. Means this atrium starts to excite. So when it is a P wave, entire P wave means this our atrium is there, it will contract and it will pump the blood into the ventricle. Then there, after some time, we can see there is a QRS complex. So this QRS complex means once the blood will reach to the ventricle, this ventricle region will contract and it will pump blood. So this will be denoted by PQRS. Now this atrium is there. When this atrium will pump and get relaxed, so this relaxation is so slow that it cannot be absorbed in the ECG. However, when this ventricle will get relaxed, so it will be absorbed in the ECG and that will be demarked by the T wave. This is called ventricular repolarization. The midline, the baseline, this is called isoelectric line. So this is a basic understanding of ECG. Just a recap of ECG. You might have studied in the human anatomy and physiology in the Pharm first year. Now with this basic, we are going to see some more few points in the today's class. Then tomorrow onwards, we are going to start the disease of cardiovascular system. Now here, S1 heart sound, generally we are telling it as a love sound. What it means? It means the sound comes by the closure of atrioventricular valve, right? So this is a heart, this is a heart. So this is a atrium, this is a atrium, these are the ventricles. When this atrioventricular valve will close in both sides, it will produce one sound. That sound is called S1 sound, or first sound, or love sound is the common word we will say. So it means that there is a beginning of systole and there is going to be contraction. Then this second sound is due to the semilunar valve. Semilunar valve matlab from this ventricle blood will go to the lungs. From this ventricle blood will go to the aorta and in the systemic circulation. Once this blood is pumped to these major blood vessels, major arteries, what happen means this here one valve is there which is called semilunar valve. So once this blood will go into the blood vessel, it should not come back. It should not come back. That's why this bulb will close. When this bulb will close, it will produce the S2 sound. So this is called second sound, called dub sound also. Hope you understood. Then there is one another concept of cardiac output. If we will understand this, it will be very easy for us to understand the hypertension in the another class. We will be starting with the hypertension. What is the cardiac output? It is the amount of blood pumped by our ventricle in 1 minute. In 1 minute, how much blood is getting pumped by our ventricle? That is called cardiac output. Now, this cardiac output can be derived as heart rate into stroke volume. Now, what is this stroke volume? Stroke volume is a volume pumped by a ventricle in each heartbeat. So, here I have kept one example. So, this cardiac output will come in a unit of ml per minute. Now, here, let's assume my heartbeat is 75 beats per minute and my stroke volume is 70 ml. मतलब एक बार जब मेरा ventricle contract कर रहा है, it is pumping the 70 ml of blood. And my heartbeat is 75. So what will be my cardiac output in 1 minute? In 1 minute, 75 beat, volume 70. 75 into 70, we will do 75 into 70, which will be around 5250 milliliters. That is 5.25 liters in a minute will be my cardiac output. Now this cardiac output is there. This cardiac output will define how much blood is pumped by our heart in 1 minute. Now there is one another important concept called preload, which will be very useful in the congestive cardiac failure. So here in the preload, what is preload means amount the ventricles are stressed by the contained blood. So this concept will be very useful in the congestive cardiac failure, which is another topic of our discussion in the cardiovascular system. So it's very important to understand what is preload. The amount ventricles are stressed by contained blood, right? In this ventricle, when there is a blood, so these are the ventricles. In this ventricle, if there is a blood, it will exert some pressure, right? So that stretching pressure is known as preload. Then similarly, contractility, cardiac cells contract with some contractile force. This is called contractility. There is nothing much to discuss. Then afterload, this preload and afterload should be understood well. Back pressure exerted by blood in the large arteries while leaving the heart. Now, here we have discussed that the right ventricle will pump blood to the lungs and left ventricle will pump blood in our body. Now, when it is getting contracted, now blood will go to these large vessels, right? And there are valves. These valves will prevent this blood will not come back to the ventricles. Now, what is the pressure exerted in these valves by the pumped blood? So this pressure is known as afterload. What is this? This pressure is known as afterload. However, the pressure exerted in the ventricles by the blood, this is known as preload. Hope you understand this concept. So if you have understood this concept, in the another class onwards, we are going to start the cardiovascular disease. So stay tuned for the classes in the coming lectures. So stay tuned to channel. Please share the channel with your friends. Like, subscribe our channels, and if you liked it, you please like here. And if you are having any suggestions, feedback or anything, you can give me a feedback also. So thank you. See you in the another class.